Okay, so now we have everyone online?
Yes, I think so, yes.
Okay, perfect. I hope you heard my introduction. If not, I apologize again for making you wait for this webinar. You need to know that this webinar is being recorded. These are my disclosures. This webinar has been organized by CELL, and I am a speaker for CELL for this webinar. Next slide. A few words about myself. I'm a board certified plastic surgeon. My current focus is on aesthetic medicine and surgery, and I've been working in Switzerland in an entourage clinic since the beginning of 2023. Next slide. Today's agenda involves talking about hair biology and current therapies for hair disorders, followed by we need to dive in a bit in the check technology, which is at the heart of CELLBOOSTER products. And we will finish by seeing how we can use the product in our practice and how we can strengthen the hair by efficiently using the CELLBOOSTER hair, because this is our focus today. Next slide, please. So, of course, before hair disorders, it's good to understand a bit the normal hair follicle anatomy. Hair follicle, it's an intriguing structure. We still have a lot to learn about its anatomy and its mechanism. Basically, we can look it as a complex mini organ. It is made up of epithelial cells and mesenchymal cells, which together with the sebaceous gland and erector pili muscle will form the pilosebaceous unit. It's classically divided in three segments, even though some others include a fourth segment description. The superior one is the infundibulum, the next in the middle, the isthmus, and the inferior one is contains the bulb and the suprabulb. The superficial part, the superficial segment, the infundibulum, will communicate with skin surface and also with the sebaceous gland duct, permitting this being a way that the topical agents that we put on the scalp can penetrate inside. In the isthmus region, we have the insertion of erector pili muscle and the bulge. The bulge is an important region because this is where the hair follicle stem cells reside. During the initial phases of hair growth, these hair follicle stem cells will go towards the bulb in order to proliferate and differentiate. So these stem cells are very important in hair regeneration and also in reparative processes. The bulb, the inferior part, it contains the dermal papilla. It has also some rapidly dividing cells that will generate the hair follicle. It's a complex process to obtain in the end the hair shaft. Can you please go to the next slide? So we know that hair follicles, human hair follicles undergo cycles of growth, which is the anagen phase, of regression, the catagen, and rest, the telogen phase. And also we know that not all hair follicles are in the same phase in the same time. Normally 80 towards 90% of hair follicles are in the anagen phase, 1-2 in the catagen phase, and the rest in the telogen. So during the anagen phase, the hair follicle regenerates fully. This is where the hair shaft is produced with its pigment also. It's a phase that can last between 2 and 8 years. It depends on many factors. Then at the end of this phase, the hair follicle, it will go into catagen phase. This is where cell proliferation stops. The hair follicles go into regression. It lasts between 1 and 3 weeks, and what we have at the end in this stage is a club hair. The telogen phase, which normally is presented like the resting period. Actually, it has been seen that there is still a lot of activity going on during this phase. In the initial stages, the hair growth is inhibited, but then the sensitivity to all the stimulus increase, and as this phase progresses slowly to the anagen phase, we will have we'll begin to have the hair regrowth, and the last hair from the last cycle will come off, will shed. So of course this is just a schematic representation because there are many factors that influence this, the length of the phases. There are factors like nutrition, genetics, hormonal imbalance, even external factors that can change the normal uh, these phases and the duration of them. Next slide, please. The keratin production is an important event. It occurs in the hair bulb. This is where the keratinocytes proliferate and differentiate. As the cell move upwards through the hair follicle, they start to synthesize keratin proteins, which will aggregate. They will form a cross-linking, and then we will form the hair shaft. This is slowly the cells will lose their nuclei and all the components in the cytoplasm, resulting in dead keratinized cells that create the structure of the hair. The composition and organization of keratin determine the hair strength, the texture, and overall properties. Next slide, please. So we have some amino acids that play a crucial role in hair keratin formation, as they represent the building block of keratin proteins. Specifically, we have the cysteine, which is vital because it will form disulfide bonds. This will provide strength and stability to the hair structure. But there are also other amino acids like proline, glycine, and not only that will contribute also to the unique helical structure of keratin. The overall composition and balance of amino acids will directly influence hair strength, hair health, growth, and appearance. Next slide, please. Okay. Hair aging is characterized by many changes in hair structure. Cycles are changed, pigmentation is reduced. As individual age, hair follicles will produce thinner and weaker strands. This will lead to hair loss and decreased density. The rate also of hair regeneration will slow down, and the transition between the phases will be different and less efficient. Additionally to this, melanin production declines, so the result will be a graying of the hair. All these changes can be influenced by genetic factors, by hormonal imbalances, by external factors like radiation, like pollution, and everything will again contribute to the overall aging appearance of the hair. Next slide, please. The unwanted hair loss is known also as alopecia. This is a prevalent condition that affects all genders, and also it can manifest in various patterns. Broadly, we can categorize it in scarring alopecia and non-scarring alopecia. The most common non-scarring type of alopecia is androgenetic alopecia, with or the pattern hair loss, which can affect men but also women. Um, in women, of course, the hair loss pattern will be slightly different than in men. This involves the miniaturization of the hair follicles that will lead to shorter, finer hair until the follicles eventually will stop producing hair. We have other types, so also in the non-scarring type like alopecia areata, and this is characterized by patchy hair loss, particularly on the scalp, but we can have other areas in the body that are affected, like beard, eyebrows, or even go into the totalis variant, where we lose all the hair in the on the scalp, and universalis we lose all the hair in the body. Scarring alopecia is somehow different, or this is also called cicatricial alopecia. This can result from various inflammatory conditions, including cutaneous manifestations of lupus. We can have a bacterial infection, but we can also have as a cause trauma like burns. These conditions lead to shiny, bare patches on the skin, often causing permanent hair loss in the affected area. There are other site types, telogen effluvium, there are drug-induced alopecia, there are many other types, but these are the most common, so we will not to continue with the explanation of other different types. Next slide, please. The pathophysiology of hair loss is a complex one. The inflammation plays a crucial role in the pathogenesis of certain types of alopecia, like androgenetic alopecia, not in research that didn't uh, see this inflammation in all the cases, but in a significant percentage, there is they've seen there is a chronic infiltrate around the hair follicle. It is proposed in these instances to use the term microinflammation because it is a slow and subtle inflammatory process observed in this kind of androgenetic alopecia, in contrast to a more pronounced inflammation that it can be seen in the beginning phases of the scarring type. So this is important to know, this microinflammation, which is also sustained by the fact that anti-inflammatory drugs like minoxidil can help ameliorate condition. This microinflammation also will lead to secretion of factors that will disrupt hair growth cycle. Next slide, please. There is also a nutrition deficiency that can significantly contribute to alopecia by disrupting the hair growth cycle and impairing the health of hair follicles. There are some key nutrients like proteins, vitamins, minerals, fatty acids that play a very important role in maintaining hair structure and function. Deficiencies in these nutrients can lead to hair thinning and increased shedding. There are also some studies that show this, like for example, Korean population found that patients with telogen effluvium and alopecia areata exhibited low zinc levels, indicating a metabolic barrier to maintaining balance. There is also a study conducted on Turkish population with androgenetic alopecia revealed that while serum zinc and copper were normal, when they tested some hair samples from the bald areas, showed that there it was a reduced concentration of these oligoelements. This suggests that local circulation issues may prevent affected follicles from using the essential minerals effectively. So this is where we can come and inject directly some products in order to be used properly. Even it has been that supplementation with B vitamins and amino acids will enhance the efficacy of minoxidil treatment. Next slide, please. In scarring alopecia and advanced androgenetic alopecia, there will be fibrosis also around hair follicles. This will lead to reduced blood supply and replaces healthy tissue. Of course, this will impact all the cells, the stem cells mainly, and it has been seen that this fibrosis results from increased levels of transforming growth factor beta. This also will inhibit normal signal pathways and will promote collagen production. The excess collagen increases hair follicles, will disrupt their ability to differentiate and grow hair, but also additionally, amino acids that should contribute to hair transformation are redirected for collagen synthesis, so further impairing hair growth. Next slide. Uh, so if we take, for example, scarring alopecia, where of course the treatment options we have are quite limited, we can at the beginning we can reduce inflammation and address the main concern, but once the scarring occurred, it is more difficult. But we have some main aesthetic hair concerns that we can address with good treatment like non-cicatricial alopecia, damaged hair shaft, androgenetic alopecia, premature graying, just to name a few, and where I will talk about this later, that our product, Cell Booster Hair, can be also very efficient. Next slide, please. Of course, there are many therapies proposed today on the market. I will not present everything that exists. Next slide. I just want to share with you what I'm currently using. So from a medical point of view, I use the 5-alpha reductase inhibitors, minoxidil, and in some specific cases, we can do a genetic testing in order to obtain a personalized treatment plan for the patient. As minimally invasive procedures, of course, now I introduced the Cell Booster Hair in my practice, alongside with PRP and microneedling, and in a late um, instance, or where the patients want this from the beginning, we can go for hair transplantation. Next slide, please. So, what is cell booster hair? Cell booster in general. Let's start with this. What are cell boosters? This is an injectable product of stabilized booster complex that has inside a hyaluronic acid molecules with amino acids, with vitamins, and with oligoelements. It's very important to know that they are class 3 medical devices. So what we can understand from this is that they are safe products. We can safely inject them. They have a CE mark. They are Swiss made, and the technology used in order to produce them is a patented technology by Swissair. Next slide, please. We really need to dive into the check technology a little bit because this is what sets this product apart. Next, please. The check technology is basically the method that Swissair uses in order to stabilize the hyaluronic acid molecules. Why do we need to have in our products a stabilized hyaluronic acid? Well, it's because otherwise it will be degraded very quickly. So if we stabilize the molecule, it will last longer in the tissues. It will have prolonged effect, and specifically in this case, it will be able to release gradually all the ingredients. And like this, we will not have an agglomeration of ingredients around the hair follicles or in the injected area. And we will not have a competition. We will reduce the competition of the active ingredients on the receptors. Next slide, please. Basically, why is this method different? Because it's a mechanical method of stabilizing the hyaluronic acid molecules. The other methods for cross-linking, for example, they use chemical binders, but in this case, everything is mechanically. So in the first step, on the high molecular weight hyaluronic acid molecules, there is an external pressure that is applied in order to create a shear deformation of the molecules. Next slide, please. This will permit the hyaluronic molecule to open up and to incorporate inside it the active ingredient. There will be some molecular links that will form, and in a final step, next slide please, in a final step, once we remove this external pressure, the hyaluronic acid molecule will compact, and what we will obtain is a three-dimensional stabilized complex. And in the next slide, we will see a video of all this process, exactly what I explained to you. You can now go to the next slide, please. So this is the video with the process, the main steps, the high quality hyaluronic acid, and with external pressure that is put on top of it, we will do this shear deformation. The active ingredients will go inside the molecule. It will create the bonds inside, and once this pressure is uh, taken off, what we obtain is a stabilized complex. Thanks to different ingredients, mix of different ingredients, there are four different products that can address different indications and different problematics. Next slide. Next slide. And already, as you can imagine, after seeing a bit how things are done, there are some key advantages of this method. First place, there are no chemical binding agents, which make the safety profile of this product even better. At the same time, it will be a gradual and an optimal release of active ingredients. And thanks to the fact that there are a specific mix, a unique mix of ingredients inside the hyaluronic acid molecules, we will have multiple indications, and even for one product, we will be able to address different problematics, different things. Next slide, please. As I mentioned, there are four different products, and today we will insist only on the Cell Booster hair. The other ones are Lift and Glow, can allow us to work on to improve the skin quality, and with Cell Booster Shape, we can reduce stubborn fat, small deposits of stubborn fat, or to improve the aspect of cellulitis. Next slide. So let's see what's inside this innovative product from Swisel called CELLBOOSTER Hair. Next slide, please. As mentioned, everything starts from the hyaluronic acid molecule. So inside this stabilized hyaluronic acid molecules, which is in a concentration of 80 milligrams a bottle, knowing that every bottle contains 3 milliliters of product, will give us 6 milligrams per milliliter. So inside this molecule, we will have vitamins, many vitamins from the B group. We'll have glutan, vitamin P, as a flavonoid. We have amino acids, arginine, cysteine, glutamine, glycine, lysine, and as oligo elements, there is copper and zinc. You can go to the next slide. Everything together will, and every ingredient has its beneficial effect in the tissues where this is delivered. For example, the hyaluronic acid, we know that it has the property to hydrate tissue, as we mentioned, it will stay there for a while, it will not be immediately degraded. and it will give a mechanical cell resistance. In the same time, this is an optimal vehicle for the active ingredients that we discussed already and we will discuss further. Can you go to the next slide, please? So the vitamins, what will they do? There are multiple vitamins, so we will have multiple beneficial effects on the hair metabolism and hair growth. We can obtain with this improved hair pigmentation, development of hair follicle. But not only this is also there. They have also an antioxidant effect. It will improve hair elasticity. It will also stabilize the anagen phase and prevent apoptosis. Next one, the amino acids, starting from the point where they are the building blocks of the keratin in the hair. It will help in hair regrowth and prevent hair loss. In the same time, if keratin is good, is strong, the hair will be strong. But it also has a they have a good antioxidant effect and will influence the iron and zinc uptake, which we also know that they are important in healthy hair. Next slide. And the oligo elements, the zinc and the copper, very good in helping hair growth, and they are good also in regulating the sebaceous gland activity. They will decrease the premature graying and also improve decrease hair loss. Next slide. So, as mentioned, this is just a conclusion of what this product does thanks to its active ingredients and this complex mix. We have basically healthy skin because not only hair follicle needs to be healthy, we need a healthy skin also. We have an antioxidant and anti-inflammatory effect. We will have a hair growth improvement with a prevention of hair loss and premature graying, and also good quality hair to help with strengthening and giving vitality to the hair. Next slide, please. Well, what is the target? Because we said this is an injectable treatment and it's important how we put it in the target area. We need to go where the hair follicle is, which is in the dermis. Uh, can you go to the next slide, please? And also we need to follow a good protocol in order to achieve the maximum of results. Meaning that CELL proposed this protocol for hair treatment. It is divided into an intensive course and in a support course. The first part, the intensive course, it consists of 6 treatments with 2-3 weeks interval between them. And the support course, this is something that you can decide as a doctor depending on how your patient, what's the evolution of your patient, what's the status, because sometimes maybe we need to repeat it 1 time a month, sometimes if things are stable, because in the end this is what we want, stable, not to continue towards hair losing. There we can go one every 6 months with a treatment. Next slide, please. The injection technique, of course, we will start with disinfecting the area we plan to treat. Of course, in the hair, it's quite difficult to realize this because everything will get moist. It's not very nice for the patient. Me, I'm using a spray and I will put it only the roots of the hair in the area I want to treat. Anesthesia is really complicated to obtain it for this minimally invasive treatment. So me, I do this without anesthesia. My preferred injection technique is the micropapilla. So we go in the dermis. I prefer a 33 gauge needle, 4 millimeters. Like this, we can insert all the needle inside the dermis. It's important not to go very deep. If we use longer needles, we need to be careful because if we go too deep, basically we will lose the product. We don't have need to be scared of side effects. It's just that we will not have we will not have an effect. Injection angle is 30 degrees, and we need to decide if it's all the scalp area that needs to be treated, or if the problem is concentrated in certain areas. But ideally, it will be to inject 0.025 milliliters in each injection point, and to leave a few millimeters between the injection points. For also nappage technique was described, but I need to be honest, that me, I never use this kind of technique. If we want to treat some areas on the face, like the eyebrows or the beard, the things are similar, like for the scalp. Next slide, please. I created here a video. Can you play the video? To show you exactly how the procedure is done. Basically, in every we have 6 bottles in every package of Swiss Cell Booster. There is a plastic cap that needs to be removed before taking out the product, but the other cap you need to leave it in place. I prefer to use 1 ml syringes luer lock because I find this is easier to dose your product. A bigger needle to remove the product from the bottle. I use 18 gauge or even a bit smaller. It works very well because the product is fluid, so you will not have difficulties in removing or injecting it. I told you already that I prefer this kind of needles that are 4 millimeters, 33 gauge. This is the final syringe, so 3 syringes in total that we need to divide according to our patient's needs. The problematic in this particular patient was especially in the frontal lateral zones, but also a bit in the central one. So I made my plan in order to help myself divide equal amounts of product. I just made some marks on the skin. We will inject the product slowly, and this is important also for pain, but also for the fact that if we put too fast a lot of pressure, the product will have the tendency to come out. So we go slowly uh, in every injection point, and we try to deliver 0.025 milliliters. So it's not difficult to see this on the syringe. There might be some instances like here where I put a little bit, I concentrate more product in a specific area. And the reason I did this is because this patient was having seborrheic dermatitis. I will show you later some photos with him. Now here we don't see much because it's the second treatment. But in these instances, you can go with no problem, and you can inject a little bit more product in these areas in order to have even a more stronger effect. I think, yeah, the seborrheic dermatitis is not on the list of indications for cell booster hair, but we observed with clinical experience that it has a very good effect actually on this kind of pathology. It will reduce the inflammation, improves microcirculation, and everything basically will slowly disappear. We know that this chronic condition can be sometimes a bit bothering, it's itchy, it's not very nice not very pleasant for the patient. Next slide. Cell booster can be combined, and this is the beauty of it because it is a safe product, in the same time it's a strong one. So if we decide to combine it, it's important to do it think if it's necessary or not, because already alone it has very good results. But if we want to combine it, we can combine it, for example, with the PRP. Uh, I don't consider necessarily in the same session, but if you decide to do it, and I did it also, if it because maybe patients sometimes insist they want both treatments to be done, you can do it safely with no side effects. But I prefer to do it after 2 weeks, 2 weeks, 3 weeks interval. I had our two colleagues, Dr. Gabriel Siquet and Timur Taskesen. They provided also a protocol on how to combine effectively the cell booster hair with laser. Next slide. So me, I don't use laser for the hair, but I find it a very, very interesting way of delivering this treatment. Basically, you start with the laser after a cooling period of 50 or 20 minutes. You can proceed to inject the cell booster hair. So if you already have this in your clinic, it's a good way to improve even more the effect of the laser. Next slide. Next slide. In order to demonstrate even more the efficacy and the safety of cell booster hair, a clinical study was conducted on 25 healthy subjects. They were equally divided between men and women. This clinical study basically assessed the effect on hair density and hair quality after 6 treatments of cell booster hair injection. The evaluation was done at, at the beginning, so before injecting the product, at 40 days, so after 3 treatments, and at 90 days. The next slide. Next, here you can see only the inclusion criteria. The patients that were included, they agreed, they signed the informed consent to participate in the study. All patients were major. They didn't have a criteria to be excluded. Next slide, please. And basically, what this study observed, on the one hand, they made a clinical evaluation of all the subjects, and on the other hand, a biometrical evaluation. From a clinical point of view, it's they obtained very, very good results regarding hair thickness that showed an improvement more than 37%. Next slide. More than 30% also in shine of the hair. Next slide. And a very good improvement or decrease in hair loss of over 50%. Next slide, please. From a biometric point of view, using the macro photography, the study obtained a 26% improvement in hair density. Next slide. And this is a photo showing this, the use of macro photography. You can see at point 0 and after 90 days how the hair density is improved. Next. Also, the biometric evaluation showed a more than 9% improvement in thickness of the hair. Next. And more than 38% in shine using the glossimeter. Next slide. And maybe more for us as doctors, of course, it's very important to have clinical evidence. But when we regard our patients, we need to obtain a high satisfaction for them. They will look less at the numbers, but they will look more on how their condition improved. And this study showed a very, very good very high satisfaction from patients' part. Next slide, please. The graphic showing the same thing, but basically 89% of patients found that their hair improved, much improved, or even very much improved after this treatment. Next slide. Some photos of the patients that participated in the study. You can see this is not even at the end of the treatment, is in the middle after 3 sessions, and we already see a very good improvement in the hair density and thickness. Next slide. Another one at 3 weeks. Next. The same thing at 3 weeks, before and after. Next slide. 3 weeks. Next slide. 3 weeks. And now I think we will see the results at the end of the clinical trial. So after 6 sessions, we can see a very good improvement. The same thing at 90 days. Next. A woman also with a very, very good result after the 6 treatments. Next slide. Another one at the end of the 6 treatments. Okay. Next one. So to conclude, this is a strong clinical trial that allows to show good results at only 3 weeks at the end of the treatment regimen, which from our point of view for doctors, it has a good clinical, we have good results regarding the clinical evaluation and the biometric assessment, and a very good satisfaction for the patients. Next slide, please. Next. Okay, so I come back to my patient. Can you start the second video also, please? Because this is my patient before we started the treatment, and after only 1 session, 3 weeks after only 1 session, he was having many patches of seborrheic dermatitis in the scalp that was itchy. He was always trying to do this. He was having dandruff, and this is how it looked at before his second treatment. Basically, in the photo, we almost don't see anything. I can tell you that in reality, what I've seen, it was a very slight pink coloration in the area where previously we had this black. Next slide, please. This is another good example of what we can obtain by utilizing CELLBOOSTER hair treatments. This is my patient after 6 treatments that I conducted over a period of 4 months. We can see improvement in everything: hair density, hair pigmentation, shyness, structure, everything is better. Next slide, please. This effect on scalp seborrheic dermatitis was also published by my colleague, by our colleague, Dr. Sikiaki, who presented this as a case report. You can see this very good effect after 3 sessions with 2 weeks interval between each session. We don't see the scaly on the scalp anymore. It's basically disappeared only by using only the CELLBOOSTER hair. Next, please. Alopecia areata, not only on the scalp but on the face, also can be improved with the use of CELLBOOSTER hair. This is a before and after 6 sessions with 2 weeks interval between each session. Next, please. So I think we have enough explanation on the CELLBOOSTER hair product. It is clearly an innovative treatment for hair loss, but not only. We can use it to ameliorate other conditions than hair loss. It is a safe product to be injected. I never ever had a side effect with it. I don't know, and I don't think that they that have been reported with this the use of this product. Maybe if they are related to for hygiene or for indication of the product. The patented technology that Suicel developed is unique, and uh, this why we like this product. This is why it's efficient because we have this very slow uh, degradation of of the molecules and release of ingredients. We have also scientific support, and we can say that it's safety and effective. Next slide. In conclusion, I think it's very easily to be integrated in everyday practice. We can today, in my opinion, we will not treat hair loss only with one treatment. We make usually a combination of treatments. It depends, of course, on the type of alopecia, but uh, combined treatments work better, meaning medication, hair routine for home, what to avoid, maybe a lot of general advices go hand in hand with our medical treatment. Um, so it's very easily to be incorporated in everyday protocol. For me, the strongest and the most logical combination is with the minoxidil, and this is what I propose the most for my patients. So we were late. I don't want to. I think we should stop here in order to see if there are some questions from the audience, and I would like to be able also to respond to you. It's late. We passed our initial program, so I will look. If you have questions, just type in the Q&A box, please. So Giacomo Dal Porto, he asked, treating the head using a needle of 4 millimeters, how much we go in, 2, 3 millimeters, or with all the needles? So we can go with all the needles when we use a 4 millimeter type of needle, and this is also why I like to use it. If we go a little bit superficial, in my opinion, there is no harm, but if we go deeper, there is where we can lose the product in the in the deep layers. Um, if you basically the hair follicle in the scalp is at 4 millimeters, so that's the rationale behind this behind my answer. It is necessary to inject in the not damaged area. If we're talking about alopecia, um, pattern type alopecia or alopecia areata, I would always go outside a bit of the damaged area because it doesn't mean that it's not affected. It doesn't mean that we just maybe it's at a microscopic level and it can evolve to a clinical stage. But me, yes, I always go inside, and also it's important if there is zero hair follicle activity, we will not inject. If the hair follicles are completely dead, if a patient with androgenetic alopecia has this everything empty for 20 years, I don't think that those hair follicles will be revived with our injection. So I will always corroborate what we have from a clinical point of view and with our judgment. Do you introduce all the length of the needle? Yes. For Maria Dolores Arias, yes. For my needle, the needle I use, I introduce all the length. The needle is 4 millimeters, so I'm not scared, and especially that it's not perpendicular, it's oblique. I'm not scared that I will go too deep. I don't always get 3 milliliter from the ampoule, so I would appreciate if it had a little more in there for the cooling amount also. Thank you. Yeah, this is something that they regulated. Now it's a bit more. Not to have this kind of problem. It's more strictly controlled the quantity in the ampoule. Can we use it as a microneedling treatment? Honestly, I think we can use it how we want and we feel comfortable. Um, I don't use it as a um, topically with the microneedling, as I do sometimes with the PRP. I don't use like this because I feel that I'm losing the product, so I will prefer to inject it. But if you want to try, you can. I am sure that it will be efficient, but a bit more product will be lost if you just put it topically. If not, you can associate it with microneedling and injecting the cell booster, because basically the microneedling will just enhance the trauma and will create a little bit more inflammation. Is it safely for the cancer patients? I will. I think here is very long and ethical discussion on cancer patients. I think, and me, what I do in my practice, I wait that the patients are cancer free. And of course, that's important if the cancer is close to the area that you want to treat or it's far. But if this is a patient that undergoes a lot of chemotherapy, because maybe this is why you ask me for the chemotherapy induced alopecia. I wouldn't. I wouldn't treat. I would wait to be in a cancer-free period before starting the cell booster hair treatment. And I'm not sure that we will be able to provide clinical studies because it's yeah, we talk about ethical things here. So I would wait for this kind of patients. In how much time the papilla will disappear? This is very fast. What you can get, and this is very important also. I recommend to my patients to wash their hair the day before or the morning before the procedure, and not to apply any chemical products after, before the treatment basically. And then the scalp can be irritated like the first day. We will not see the papilla. The papilla disappears quite quickly. We can see the little points of injection, like the small blood. Sometimes it can be like a crust. And I tell patients to avoid immediately after to wash their hair, not to traumatize it more. Um, so basically, the next day or after 2 days, they can wash the hair, and after they will really not see anything on their scalp. How can we combine at patient which did hair transplant, and which are the results? We can do the same thing as we do with PRP. So, or another thing, what you can do is to go in parallel with PRP. For example, if you start a PRP 1 month after the hair transplant, as mentioned already, I will not go in the same session. But as the protocol involves usually PRP after a hair transplantation, that's always something that is, patients need to know that did everything uh, according to the protocol to be happy. So not to have problems that you completely replace the PRP with the cell booster hair. You can do in parallel, and it will only accelerate and maintain the effect. Don't hesitate to contact us or the Swiss Cell team or even me for no matter what question regarding this product. I'm here. WhatsApp, sorry, Instagram. You can text me and put me more questions. So thank you again, everyone, and thanks for the Swiss team. I think we can slowly finish this session.